March is Colon Cancer Awareness Month, and according to the CDC, it caused the second most number of cancer deaths in the U.S. in 2020. Joining us today to talk about this important topic are Katherine Anderson from Cancer Centers of America and Dr. Nisha Sharma from St. Francis. Welcome. Thank you guys for being on the show. We really appreciate this. Colon cancer, obviously a very big topic for people out there. First off, is it common? I mean, how often do you guys see colon cancer, and how important is it to get screened?
Right, so it's the third most common cancer out there, men and women combined. So the incidence has been going up for the last few decades, especially if you're 50 or younger, because I know 50 used to be the older guideline, but if you're 50 or younger, you're 2 times more likely to get colon cancer now than you did in 1950, and you're 4 times more likely to get rectal cancer. Yeah. So we've seen an uptrend in the incidence of both colon and rectal cancer over the last decade. So the current guidelines recommend screening patients at 45 instead of 50. So if you're 45 and up, then get screened.
Yearly, or is it something that you do maybe every 3 or 4 years? When should somebody start to do this and make it a regular thing? Right.
So once you start getting screened at 45, there are a few different ways to get screened. The 2 primary ways remain a colonoscopy, which is probably the gold standard, and then you have stool-based testing, which is something called a FIT test that can be done annually. So colonoscopy for an average risk person would be every 10 years, unless we find polyps, there's positive family history, or we find something more concerning like colon cancer.
So if somebody at home is watching this right now, what are some symptoms that you should look out for and maybe be like, I should go see my doctor, maybe I should go get one?
Right. So the 45 guideline is for asymptomatic patients. So even if you have 0 symptoms, go get screened at 45. However, if you have any change in bowel habits, if you notice any blood in stool, if you have unexplained weight loss or abdominal pain, those would be some common signs to look for.
Okay. Gas, cramping, certainly any family history, those should be notations that you'd get screening earlier as well.
Yeah, and I want to talk about the Cancer Treatment Centers of America.
Sure.
What resources do you guys offer for colon cancer, and what is the prognosis if somebody catches this really early?
So the prognosis is good if you can catch it early. Obviously, an earlier stage 1 disease is going to be, a lot less serious interventions that are needed for treatment. So maybe surgery and not having to get chemotherapy or radiation. There's lots of resources out there. Certainly, Cancer Treatment Centers of America has our website and a number of people that are available to answer questions and concerns. There's also American Cancer Society, colorectal cancer, a number of different organizations that can provide valuable resources.
You guys have an event coming up. It's a little bit later this year, but tell me about that. It's a run and walk, and
yes.
How can people get involved in that? And tell me about it.
Yeah, absolutely. So it's an annual run that we do. It's called Get Your Rear in Gear. It's 10 a.m. Saturday, November 12th at Guthrie Green. We hope for a wonderful day, and it's a 5K runner walk. So a lot of fun. Get the family out there. We'll have lots of educational resources, and it's really to support families, patients, and others, and fundraise for colorectal cancer awareness.
Okay, great advice, great information, and put that on your calendar because it's coming up down the line. So.
Definitely.
All right, guys, thank you so much. We really appreciate it.
Thank you for having us.
Thank you. Yeah.